A different kind of head trauma, allergic reactions to fluids, and zipper-related disasters. What? That's right. Today we're diving into even more of the wildest and most unexpected sex-related injuries that land people in the ER. Potential warning. Now, before I go any further, if you couldn't tell by the title or intro of this video, we're talking about terminology that may not be advisable out loud on public transit or at your grandma's house. Please keep that in mind. All right. Let's dive right in. Number 10, allergic reactions to semen or lubricants. Believe it or not, some people are allergic to semen. A real condition called seminal plasma hypersensitivity, aka semen allergy, can cause burning, swelling, and even full body allergic reactions when exposed to a partner's bodily fluids. That being said, we also see patients reacting to lubricants, flavored condoms, or certain sex toys because their skin decides, nope, absolutely not. Some cases are mild, but others can turn into full-blown anaphylactic shock and a full-body freakout that can be life-threatening. In the ER, we treat these reactions with antihistamines, steroids, or even epinephrine. So moral of this lovemaking story, if you have a sudden severe reaction after sex, do not try to wait it out. Get immediate medical help. Are you allergic to anything in the sex ed department? Let me know in the comments. Number 9, air embolism from oral sex. In extreme rare cases, air introduced into the vagina, for instance during oral sex, can create an air embolism, which is essentially a bubble of air that enters the bloodstream and can block circulation. It's especially dangerous during pregnancy because the air bubble can travel to the placenta and cut off oxygen to the baby. In the emergency department, we treat air embolisms with oxygen therapy and positioning techniques to help the air bubble dissipate safely. But if someone is experiencing sudden onset chest pain or difficulty breathing after oral sex, get to the hospital immediately. Number 8, sex-induced heart attacks. This is especially common in older men or people with pre-existing heart conditions who suddenly decide to play it fast and loose with their cardiovascular system. So why does this happen? Sex is a workout on the body. Your heart rate spikes, your blood pressure surges, and if you're already at risk for heart disease, that extra exertion can trigger a cardiac event. And suddenly, what was supposed to be a fun night turns into a very awkward 911 call. Now, if you're having chest pain, dizziness, or extreme shortness of breath during or after sex, that's not something to shrug off. Seek medical help ASAP. Number 7, hernias from sex. A hernia happens when an organ or tissue pushes through a weak spot in the muscle wall. And while they can happen from lifting heavy weights or intense workouts, sex definitely qualifies as strenuous activity too. Some patients report being a little sore after an especially ambitious night. Small hernias can sometimes be monitored, but larger ones require surgery to prevent complications. If left untreated, a hernia can become trapped and cut off the blood supply to the affected tissue, leading to a serious condition called strangulation, which can result in severe pain and potentially life-threatening complications if not addressed immediately. Number 6, penile zipper injuries. This happens more often than you think.
Daddy, my zipper's stuck.
Getting yourself stuck in a zipper is not just a comedy gag, it's a real medical emergency that often requires serious intervention. When the skin gets caught in the zipper's teeth, pulling it out the wrong way can make things exponentially worse. If this happens to you, step away from the zipper, do not yank. Having a medical professional applying lidocaine gel or mineral oil can help loosen it, but if that doesn't work, we have specialized tools in the ER to safely detach you, or a surgical intervention may be required for the patient. So if you've learned nothing else from this video, let it be this: zip up with caution. Number 5, nerve compression or temporary paralysis. Certain positions, especially ones that put pressure on nerves for long periods of time, can lead to temporary numbness, weakness, or even a total loss of movement in the limb. In extreme cases, people have also lost control of their bladder because the nerves responsible for bladder function were compressed. While most cases resolve on their own, it's terrifying when you wake up feeling like you've just lost all function in one of your legs.
I can't feel my legs. I can't feel my legs.
If the nerve was compressed for too long, recovery can take hours to days, and ignoring it can lead to long-term nerve damage. If this happens, try moving, stretching, and massaging the affected area. If the sensation and movement return within a few minutes, you're probably fine. But if the numbness lasts hours, it's time to get to the hospital immediately. Number 4, sex-induced head injuries or concussions. We talk a lot about being safe and wearing protection in the bedroom, but what about being physically safe? Because let me tell you, headboards, shower floors, and nightstands have taken out more people than you'd think. The average emergency department sees concussions, whiplash, and even skull fractures from over-enthusiastic encounters that ended up with an unplanned meeting between someone's head and a hard surface. So, what do you do if you hit your head mid-act? Well, if you feel dizzy, nauseous, or have a headache afterward, it could be a concussion, which is serious. Please get checked by a doctor immediately. Number 3, friction and burn injuries. Too much friction, rough surfaces, or poorly planned props can leave serious skin burns, infections, or open wounds in very sensitive areas. Common culprits: not using enough lubrication, using ice or hot wax incorrectly, or worst of all, household objects that were absolutely not designed for human skin. We've seen everything from rug burns on the knees to full-on second-degree burns from people using heating devices way too enthusiastically. Minor burns can usually be treated with cool compresses, aloe vera, and avoiding any further irritation. But if you're dealing with severe pain, signs of infection, pus or fever, or a burn that isn't healing properly, get checked out ASAP. Number 2, uterine prolapse or cervical bruising. Deep penetration, especially in certain angles, can cause cervical bruising, which feels like cramping, soreness, and sometimes bleeding. Most of the time, this should heal on its own, but in more severe cases, it can lead to uterine prolapse. So, what is a uterine prolapse? Well, the uterus is normally held in place by ligaments and muscles, but if those become weak or strained, the uterus can literally start slipping down into the vaginal canal, and in extreme cases, it can protrude completely outside the body, which is as horrifying and embarrassing for a patient as it sounds. This usually happens more in older women or those who've had multiple pregnancies, but if there's enough force, strain, or underlying muscle weakness, it can happen unexpectedly to someone at any age. If you experience sharp, deep pain during sex or heavy bleeding afterward, that's your sign to see a doctor immediately. Number 1, hickey-induced strokes. Did you know a hickey can literally cause a stroke? No, really. In extreme cases, aggressive sucking on the neck can rupture blood vessels, leading to clots that travel to the brain. While rare, hickey-induced strokes are medically possible, especially in people with pre-existing clotting disorders or fragile blood vessels. If someone experiences facial drooping, sudden weakness, or vision changes after getting a hickey, that's not something to ignore. They need to get to the emergency room now. And there you have it, even more shocking sex-related injuries that landed people in the ER. Let me know in the comments which injury made you wince the hardest, or if you have any other questions about this topic, please drop them in the comments below. And if you want even more questions like this, check out this playlist right here. And of course, don't forget to subscribe, hit that like button, and turn those bell notifications on. That way you never miss another episode. Thank you so much for watching, and stay healthy, my friends.